Why would I, a licensed therapist and a person in long-term recovery from addiction, take ketamine as a psychedelic? And if I do, does it mean that I've relapsed? And what would a session even look like? This?
Yeah. Comfy.
In January, I headed north from Boulder, Colorado to the beautiful Sunrise Ranch, which lies just in the shadow of Rocky Mountain National Park, to receive training as a psychedelic therapist in ketamine-assisted psychotherapy from the Psychedelic Research and Training Institute, PRATI for short. In this video, I'm going to talk about my first-hand experience with ketamine, the 3 phases of ketamine-assisted psychotherapy, and lastly, my takeaways from the experience. Ketamine is a safe and legal medicine used in hospitals worldwide, and it is a substance that can be abused. So it's not a matter of whether ketamine is good or bad. It can be both, depends on the context. I am a person now in long-term recovery from addiction. Why would I take the risk? I'll tell you why. I have a strong interest in personal and spiritual growth. Over the years, there have been many practices that have been helpful for me, such as meditation, movement, especially in nature, striving for healthier eating, even if done imperfectly. That said, I still have some psychological walls that get in the way with me connecting with deeper parts of myself and the world around me. Ketamine can help break down those walls. Just to be clear, I'm not recommending or endorsing the use of ketamine. It's not for everyone, and it's important to be medically and psychologically screened before receiving this medicine. Ketamine is a medicine with psychedelic properties. It was first synthesized in 1962 and is classified as a dissociative anesthetic. What does that mean? Well, dissociation means disconnecting from your own thoughts and feelings or sense of your personal identity. An anesthetic is a substance used by anesthesiologists that makes someone insensitive to pain and is also used to knock someone out for a surgical procedure. At a sub-anesthetic dose, meaning you are not unconscious, ketamine can help facilitate a psychedelic experience that can break down psychological walls and promote healing and well-being. There are 3 phases to ketamine-assisted psychotherapy. Here's a general overview of these phases. Later in the video, I'll share my personal experience going through these phases. The preparation phase. This is the time period prior to your actual ketamine session. Some examples in this phase could be establishing a meditation practice, preparation sessions with a therapist on what to expect, setting an intention for what you'd like to focus on in the medicine journey. Second, the journey phase. This is the actual ketamine session in a controlled, safe environment. To begin, it's helpful to have either a comfortable reclining chair or some sort of floor covering like a yoga mat. Have blankets to cover up to keep warm. Also pillows for your head. Some sort of eye coverings are not required, but recommended to minimize outside distractions for your deep inward journey. A good music playlist is a must. Although I've heard some people prefer no music, that's not me. And lastly, a safe, controlled environment in which you will not be interrupted and supported with a trained professional. Third, the integration phase. This is the phase that takes place after your medicine journey. The duration of this phase varies by individual. A couple of examples are follow-up integration session with your therapist to process what happened during your journey. Journaling could be part of an integration practice. In short, integration means what you do with the experience and how it translates into changes in your life going forward. There's a lot that goes into the integration phase that is beyond the scope of this video. Maybe I'll create a separate video just on the topic of integration. As mentioned earlier, as part of the preparation phase, setting an intention is an important part of it. My intention going into this session was to examine my personal relationship with shame. A feeling of shame about oneself is not unusual for people who have a history of addiction. Although it's been 14 years since I've misused substances, sometimes there's still this lingering feeling that I am a bad person, even though there's no evidence to back this up. For the actual day of the medicine journey, PRATI took much care in creating a nice physical environment for the journey. They had things on hand such as ginger in case someone experiences nausea, water to keep hydrated, snacks for afterward. So now that everything was prepared and in place for my journey, I have some last minute thoughts that I wanted to share with you while I was in my room at the ranch just prior to my ketamine session that was just about to begin. Ketamine administered orally is absorbed through the mucous membranes in the mouth, and you swish it around for about 10 to 12 minutes, and then you give them the option to either swallow the solution or spit it out. Now, swallowing the solution does not deepen the experience, it can prolong the experience because it goes through the digestive tract. Now, I have some digestive issues, so it's best that I spit it out. The reason I'm bringing this up and why it's relevant to people in recovery, because part of me is having this internal conflict back and forth to say, ooh, I really want to prolong the experience. I think it's noteworthy for people whose moderation button is broken, such as mine. So more is not better. More is not better. There it is.
You'll also want to consider if you'd like to spit out the medicine or swallow the medicine.
Like comfy. Bring it into my space.
So, what happened? My sitter, who is your trusted partner by your side throughout your entire journey, she was a great note taker. She took down these exact words I verbalized during my journey. A shift is happening. A sea of depth and calm is coming over me. It's like I'm floating in an ocean and all alone, yet I'm not lonely at all. Up ahead there is a desert landscape approaching, which feels like somewhere in the southwest. I'm not feeling any sense of shame within me. I don't feel it anywhere at all. Not that it's gone, it's just that I don't seem to have access to it at the moment. I'm not going to force it. There is no need. I'm just cruising around in a very comfortable, warm, and safe way. I can only describe it as a soft, mellow, and peaceful experience. A song comes to mind, Easy Like a Sunday Morning. And not long after that, I started to slowly emerge out of my journey and took my time as I arrived back to begin processing what I had just experienced. Integration. Integration involves reflection. There were some dreamlike qualities in my experience. In fact, it was quite pleasant. Actually, it was really nice to get a break from what I affectionately call the monkey mind. That's a metaphor for everyday experience of thoughts just jumping around back and forth in my head. I'm amazed at how comfortable I felt in my own skin. Although that phrase isn't quite right, because I don't believe that consciousness is trapped only within our bodies, even in our day-to-day living. So that phrase isn't even complete in my opinion. In this session, I felt whole and wanting for nothing. What a nice break. For a few days after the session, I did experience what is called an afterglow, which can be described as a feeling of lightness and freedom from everyday life. With all this said, and here is the rub, the afterglow doesn't last forever. Eventually, monkey mind comes back, worries and anxiety eventually return. Is this a problem for me? No. This is part of the human experience, and the good news is I have a choice in how to respond when feelings of shame arise within me. Although I had these few days of afterglow that eventually went away, there are some longer-term benefits which I'll go into next. There were a couple of takeaways from my session. First, you may have noticed that I didn't return back to my original intention of focusing on shame in the journey. This is my first takeaway. Stay open and flexible. If I would have kept returning back to this original intention, it may have taken away from the actual experience that was naturally unfolding. Sometimes the journey takes on a life of its own. And who knows, maybe I did work through some shame by having this first-hand experience of warmth, love, and acceptance that is stored somewhere in my psyche that I can return to if I'm ever experiencing feelings of shame. Second takeaway, slowing down and enjoying the ride. This is especially helpful given the high level of enthusiasm I have for this work, both personally and professionally. It was a very meaningful and powerful experience at this training for myself and many of the other participants. So at the final evening, we all gathered around a beautiful fire. There was drumming, singing, laughter, and at the conclusion of it, we all made an offering to the fire, thinking about what we're grateful for. And PRATI added a sweet final touch at the very end of this training with one last assignment called With Love from Your Future Self. They provided us with a card titled, Just a Little Note. The instructions were to write down what you envision your life will look like and feel like over the next 12 months. Then they're going to mail the card to us individually 12 months after the date of this training. Back to the original comment I made at the beginning of the video, as a person in long-term recovery from addiction, taking ketamine as part of my own progress? For me, the answer is yes. Even though part of me was feeling some anxiety or a little nervous prior to taking the ketamine, I think what this has to do with is my perception on what it means to be sober or in recovery. Or maybe part of me was afraid that this was going to be the beginning of a long relapse into my old addictive behaviors. Turns out these fears were unfounded. It's been over 3 months since I've done this journey, and not only have I not relapsed in my old addictive behaviors, I'm not experiencing any of the symptoms or criteria of what's technically called a substance use disorder, which is characterized as a sense of craving or loss of control, or continued use of a substance despite negative consequences associated with it in one's life. It's almost a wrap, but first, to learn more about PRATI or my private practice called Inclusion Recovery, please click the links in the description below.